This is our Hospitalized Child final group presentation. It's by Emma Filson, Grace Crawford, and Sam Hall. A child life specialist is crucial to a hospital and even more so to an emergency department. A child life specialist is not just a smiling face to patients, but also an educator, a counselor, and a friend. We came to the conclusion that an emergency department would be a perfect setting to establish a CLS program in Northwest Arkansas because many children enter the emergency department anxious about an unknown place. The overall budget for the emergency department will be $100,000. The two child life specialists will be paid $47,000 a year, as this is the current state average for Arkansas. The budget for toys for the waiting room and child life specialist playroom that we spent is $1,038.13. The overall budget that we spent on the floor plan and furniture is $25,946.92. There are many details stated on the slide about the rest of our budget. The total amount that we actually spent is $38,965.46. For our program, one of the child life specialist salary will come from a grant from the hospital, and the other child life specialist salary will gratefully come from donor money. A child life program is extremely important in not only a big hospital setting, but an emergency department in particular. An emergency department can be very stressful and frantic because patients typically come to an ER because of unexpected illnesses and injuries. Having a CLS around helps not only the children, but the family as well. A child life specialist is trained to make sure that the entire family is comfortable in the hospital setting and make sure that the experience is positive. These are specific reasons why donors and administrators should invest in a CLS program. Toys can include technological toys such as phones, Xboxes, Nintendos, and other things, as well as dress-up clothes, medical play equipment, and common toys that are age-appropriate. A common activity that a CLS can do with children in the hospital setting is modeling to the children in a fun way how an IV works. The CLS will demonstrate this with a straw or a Twizzler that the child can eat afterward. With infants, mirrors, chew-safe keys, or a mobile are great, simple toys to make sure they stay occupied. In order to include a child life program in an ER setting, it is important to have an accessible space to interact with children. A child life dedicated space could include things like medical play games, privacy to practice, breathing exercises, and other things. The layout of a waiting room and CLS space will need to have some aspects of openness and others of privacy. A lot of the personal aspects will be dealt with in the child's specific patient room. Some children might talk about personal matters in the waiting room but still want privacy. In this instance, there will need to be a dedicated space where they can be comfortable to play and interact with the CLS. We will include a picture on the slide of the layout we have created for our ER waiting and CLS area. As you can see, there are many different aspects of the waiting room that we decided to include. Walking past the front desk, families will see a private space for children that need an isolated space to focus on what they're doing with the CLS. This includes comfortable seats for the child and their parents and a table where they can participate in various activities with the CLS. The same variety of toys will be included in this room and used variously based off of the needs of the child. We can include an idea of the color scheme that we wanted to utilize in our waiting room and ER setting. We thought that this happy color scheme would be a perfect mix of neutrals and bright, inviting colors. We put immense consideration into this project as if it were coming to life and really enjoyed focusing on the details and using what we have learned throughout the semester to put it all into action. We see how difficult it can be to use a specific budget to make so many ideas come true. Having a large budget can bring in so many toys and stimulatory activities for all age groups in an emergency department setting. Comforting and welcoming features are vital to making an emergency department setting more inviting for families coming into the hospital, most likely full of anxiety. Having a child life specialist in this kind of setting will benefit patients and doctors in both communicating as well as having a better quality of life during their stay in the hospital.